Greetings, everyone, and welcome to Information with Deidre. We are back in July with our Public Health Career Spotlight, and we have with us a special guest, Danielle Hosein, who is also an MPH. Danielle is a grant manager. So we are going to discuss with Danielle her path to being a grant manager and what it's like, what she does day to day. You guys know the drill and the questions. As always, this is an interactive chat. So if there's a question you have, for those of you who are checking us out on Facebook or YouTube, please feel free to put in the chat and we'll be sure to get to those comments as they come in. So welcome, Danielle. Tell the people about yourself.
Thank you for having me. I'm a grants manager, and that can mean many different things at different organizations. But currently, I manage the full life cycle of public health, law, and advocacy nonprofits grant portfolio. And by full grant life cycle, I mean from relationship cultivation, grant writing, grant management, reporting, all the way through evaluation and closeout. I manage foundation and corporate and government grants primarily, mainly foundation grants. And this work is just like working at any other nonprofit. I wear many different hats and I have to adapt, but it is a labor of love. And I'll get more into my path and how I ended up being a grants manager because it's a little unconventional. But for the most part, I serve as a thought partner with where I work now. It's primarily public health attorneys. But in the past, I've worked with other public health professionals who work in the field to help them develop the resources they need to do their job, basically. In public health, your job, your work is as good as the funding and resources you have to be able to move your work forward. So my role really is helping public health professionals gain the resources, whether they're financial resources, whether it's training, whether it's in-kind resources that they need to get their jobs done.
Okay, so that is basically about what you do and what your profession is. So to give people a little context and also use some context. So this segment came about because of a previous video and accompanying blog post, www.deidresully.com, a previous video that focused on all the different things that you could do with an MPH degree. And this is specifically for new and current students who are in the process of attaining their MPH, also new graduates or people who are looking to change careers, maybe they're just curious. So we went through like all the different fields. So, there's social and behavioral, there's health law, you're an MPH. And there's all the different like avenues you could take. And I was remembering like, I wish somebody had this like when I was in school, right? And maybe they have a lot more of those now, but I figured, as someone who has an MPH, it's like, let's reach back, let's pay it forward, reach back and pay it forward. So that is the purpose of, the Public Health Career Spotlight, right? So the spotlighting folks is the paying it forward, and the reaching back is like, hey, this is something that you can do. So being that you're a grants manager, that's kind of one of those positions that kind of can touch on all the different areas. So I would ask you, what public health fields have you covered being a grants manager?
I think it would be easier for me to just talk about my path and how I even became a grants manager, because my experience now, my role in as a grants manager, really, it builds off different experiences I've had. I didn't study to become a grants manager in my MPH program. I didn't even really know what grants really were, to be honest, until I came into the field and organically got involved in this work. So I started out actually on the program side. So I my bachelor's is in health service administration. So I started out my career early on thinking that I was going to work in a hospital and I was going to be a hospital administrator. When I was finishing my undergrad, the Affordable Care Act was being written. So it was getting ready, the bill was getting ready to be passed. And the big hot topic at the moment was healthcare access and, just expanding access to people who didn't have health coverage. That's where we were at the time. So that's where I thought that I would be career-wise. And I kind of focused my internship experience on learning hospitals and health systems. And when I entered the field after graduation, I realized I didn't really want to be in a hospital setting. It wasn't really for me. And my very first job was at the philanthropic arm of the New York City Health Department. So there I learned, about this whole field of development. That was the first time I really heard that word in the context of public health. And I got to sit in on a lot of different, meetings with high level, stakeholders. I got to sit across the room from the Commissioner of Health and just hear the exciting ideas that all of these public health professionals that worked for the city had. And, working on the government side and, for the city, you can't just do what you want. Things have to move up the food chain. There are a lot of different people who have to sign off on your ideas. And the big elephant in the room is funding. Like, how is this work going to get paid for? So, there are government grants. So the federal government, you can write and apply for a grant. But there are also private foundations and corporations that fund a lot of the public health work anonymously or, out in the open. And I got to see a lot of how all of that comes to fruition behind the scenes. There are very talented public health professionals who may have been professionally trained in public health, who their main job is to, chop it up with folks and foundations and influential members of, the public health field and beyond to get this very important work funded. So that's where it all started. And then from that point, I applied for grad school. I got into an MPH program. I went to school right in New York City, and I felt like I wanted to work at the community level because at that time, the organization I worked for was working to build programs and improve public health in New York City. So I felt like I wanted to give back to my community. So I applied for an MPH program with the community health education track. So I wanted to be on the ground, grassroots. I wanted to be a health educator. So I went through my program. I took a multitude of electives, that covered the full spectrum of the public health field, epidemiology, health policy, program planning, all of that. And then I moved on and I worked, while I was in grad school, I worked in tobacco prevention. So, I got to work in the field. And what I learned is that my skill set where I really excelled was with administration. So with helping keep the program on track, working very closely with the health educators and those that, worked on the program and policy side. I helped them either manage their budgets, track their deliverables. I helped shape the program and work closely with the program leadership, the organizational leadership to develop different strategies to meet the program's deliverables because it was a grant funded program as well. So that was my second, taste of grants management, but still from the program side. I was managing an individual grant and I really got into the nitty gritty of the day-to-day work. Mm-hmm. And I liked it. I really enjoyed it. I felt really closely to the issue, but it was on one specific public health issue area, tobacco prevention. So I moved from an organization that was fundraising multiple grants across the full spectrum of public health into one specific program on one particular issue area. And I worked at the city level, and then I moved on and I worked in tobacco control at the national level. I relocated to Washington, D.C., the DMV area, and I got a taste of, making an impact at a larger level. And at that point, I had graduated from my MPH program. I had about 5 years of experience at that point. And I was learning that, the broader you go, while my heart wanted to impact my community, I wanted to, impact New York City and, give back. I realized that the broader you go, the bigger and bigger and the more people you impact. And that was really interesting to me because working at the community level where I thought I wanted to be, you can impact individual families, you can impact specific groups, but you have the potential to impact people for years and years and decades to come and generations to come by impacting policy. So moving on to the national level, I enjoyed that. I enjoyed seeing how different parts of the country had different needs and adapting your strategy to different needs. And all in all, I'm managing grants, I'm shaping programs, I'm implementing work at the time. I'm being responsive to our funders' needs and reporting. So I'm gaining different skills. I'm learning communication skills and social media, and I'm combining all of the different skill sets that I've grown along this journey. I moved on and I moved on out of tobacco control because at a certain point, some people really enjoy working on one issue area. I really like being broad and I enjoy being a generalist. I got to the point working in tobacco prevention that I didn't always align with the policies that were being proposed or the strategies. So I moved out of tobacco prevention and into cancer prevention. So I worked for a patient advocacy organization in a program that had a racial health equity lens. So a program that was dedicated to improving health systems for Black women. And as I mentioned, when I started my career, we were talking about healthcare access. Then, throughout some experience, we were moving towards health equity. Now we're moving towards, the country is moving towards a racial awakening. So a lot of programs and public health strategies are designed around health equity within specific populations, whether it's race, whether it's gender identity, whether it's, et cetera. So I moved into that. And I was an administrator for the program. So again, I'm managing budgets, I'm helping writing grant reports, I'm drafting, correspondence. I'm still building those skills, managing and drafting contracts. And I moved into my position now where I'm a full-fledged grants manager. I am managing the development department for a small health law firm that they're the Medicaid experts. So I am working on healthcare issues, and it's like my career experience has come full circle because every pocket of experience, every skill that I've built is put to use in this position now. So I serve multiple functions in this role now. I serve as a thought partner for the attorneys that work directly. They help draft legislation. They, provide advocacy support to advocates who work in the field. They do so much great work, but in order to do their work, they need resources. They need their work to be funded. Their salary needs to get paid. And that's where grants come into play.
Yeah. So before we get into the next question, which is like a day in the life of, that was like thank you. That was a really nice, extensive, in detailed look into what your path was and kind of the thought process that went into each decision as you went along, the steps. which is good because I realized like I never shared my own. So maybe one of these shows I'll be like, I'm gonna spotlight myself and I'm gonna share like my own path. But you mentioned something that is so crucial, you could just say it. Danielle and I used to work together. So the first tobacco control program that she's talking about is the one that I run right now. So you talked about when you were with the philanthropic arm for the New York City Health Department, and you talked about basically being in the room, right? And so that's a big part of, when it comes to anything, not just public health, but like a lot of things, it's that policy piece and like being in the room. Oh no. Let's see if we do something like this. Let's see. It'll just be half and half. Whatever. Anyway, so
Just roll with it.
we'll work with it. So yeah, so you talked about like being in the room. So it's like the room where it happens, right? The room where it happens. So can you talk a little bit more about that? Because I want people to know like how important it is to how policy is important, and like, the folks who are, I guess, fortunate enough to be in that room, what that's like. So give them like a little peek into what that's like. And maybe while you're talking, I'll like fix this.
Yeah. So, I mean, at the time I was a new grad, so I had no idea what to expect. And my role at the organization, I was the executive assistant. So I worked very closely with the executive director. And I got to see one of the biggest parts of how programs and processes come to be born, and that is from a priority setting process. So every year, a lot of different organizations do this, but they set out, they come up with their annual plan of what they want to fundraise for, what policies are maybe coming down the pipeline that they know about, and how they will use their resources or what additional resources they may need to develop those programs or implement those policies, what additional staff they may need. So it's a lot of meetings. What I enjoyed sitting in on were board of directors meetings, because ultimately at nonprofit organizations, the top decision makers are your board. And there were a lot of, interesting presentations that I got to see, a lot of nuanced discussion that I got to hear about. And your board may not be public health professionals. They may be attorneys, they may be financial professionals, because ultimately, amongst other things, board members are your organization's fundraisers as well. They help, build relationships with those that can get you the resources you need. They have a Rolodex of, very influential folks that, me coming out of, undergrad or even grad school may not have. So that was a key learning lesson for me. Just seeing how, it isn't about what you know, it's who you know. Those are the skills, and those are the people that get you in the room. Those are the people who help make things happen. So all in all, one of the biggest things that I took away from that position is, even if you're applying for a grant, you're more likely to be awarded a grant if you have a relationship with the funder, if they know your name, they're familiar with your work. So it's getting your work out there. That first organization that I worked with, it was the health department. It was associated with the health department. So everyone knows the New York City Health Department, but we were responsible for, talking to people behind the scenes, and we were a public-private partnership. So government can't get awarded private foundation funding. So it was like an intermediary arm. So we kind of shepherded those relationships, and I got to watch how all of those different, relationships came to be and how they cultivated them. Taking people out for cups of coffee just to talk to them about, new ideas or something that the organization or the foundation may have been working on, and talking about how it aligns with the mission. So that was one important action, and one important part of the role that I learned, that, it should carry over into any field.
So basically networking and learning how to work a room. That's what I wanted you to get in. That was really good. Thank you.
Absolutely.
And I just want to acknowledge the chat because we have several people. Peace, Sister Kashia, Vanetta, how are you? Maxine, Munira, and Sister Sequoia. Yes, Vanetta, that was funny. That's going to be a meme someplace. Like, oh no, you know what? Maybe I'll do that, and that'll be like the way to get people to watch. Oh no. We'll just make it work for us, right? So yeah, so getting to, work in a room, like it's very, very important. And I think I'll even share, like, with the program that I work with, and also the position that I have now, it is ever it's so important to know people, to make friends, to be able to network and speak to people. And so it's crucial to for those of you who are in programs that are just kind of like very focused, because that's the issue with public health, right? Sometimes it can be very siloed where you're just working on one issue. It's like when you're doing community health, you really have to be knowledgeable about a lot of things, because people who live in underserved communities where the community health piece is really key and crucial, they suffer from a lot of different comorbidities and other issues that lead to negative health outcomes and diseases, and makes them more susceptible to things like COVID and other diseases. So it's really hard to just be like, I'm just going to focus on this one thing and put my blinders on. You right. Have to be able to be a little bit diverse. And if you're not in that space to be diverse, it's really good to start making those friends, right? And be in the room where it happens. Like, some amazing things do happen in the room where it happens. And then once you're like in the room, get at the table, and then once you're at the table, make sure you're saying something and you're participating and not just a fly on the wall. And you'll notice, like, as you get further and further along in your career path, those rooms get smaller and smaller. The amount of people in those rooms get smaller and smaller, and the people in them are more important. I'm just going to put quotations up because it's relative to what people think is important. But if you want to be in a space where you are city planning and things, so if you're in the room with the mayor or the chair, the city health committee on the council, those are going to be some important people to know. And speaking from personal experience, it's good to be in those rooms. So that's something that you would want to do if that is your career path. So I want to ask you to take us through a day in the life of, right? Like, like, what does your day look like? And I'm asking that because we do have some people in chat who are back in school, starting their own businesses. Some of them are nonprofits. And so you, as a grant manager, can really share some insight on the things that you look for when you're applying for a grant, or even if you were on the other end, because you have been on that other end where it's like giving mini grants, right? So what does that look like?
Yeah. So on a typical day, I work for a pretty well-funded organization. So on a typical day, I am catching up with some of the program staff within the organization to keep on top of what's happening. What are the latest updates? What are you working on now? Because part of my role is mission advancement, right? Making sure that we're advancing the mission forward, making sure that they have the resources that they need. Part of that is keeping track and giving our funders updates on their work. It's important to not just wait until a report is due to send a funder a highlight or something important that's happened. You want to constantly kind of be in their face and showing them, like, we're experts, we're doing this really great thing. Keep funding us, we're still relevant. So keeping up with, the program staff, I may be working on a grant application, and that involves a lot of different things. A lot of it is project management. So coming up with timelines, who needs to be involved in the grant writing process, because I think writing grants in general, it's not just a grant writer putting something together and sending it. It's not somebody just filling out an application. It's a really collaborative process. A grant writer can help put things, shape a project, but ultimately someone else is doing the work. And it's really important that all of the stakeholders are involved in the grant writing process from the very beginning, because they're the ones who know what they're going to do. They know, what the ultimate impact is. You can help be a thought partner, but those people who are doing the work, who are closest to the issue, need to be involved. You also need to involve the finance team or the communications team, different teams who collectively will shape the project. But it isn't just a siloed process. I think that's a big misconception with grants, that a grant writer just will magically put something together. It's very iterative.
Right.
You go through multiple drafts, and you're not going to get it right the first time. The grant manager really is the project manager and helps, edit, make sure that the grant application sounds like one person wrote it instead of 5 different people writing different parts. Right. Because that's the big thing that happens. It sounds choppy because everyone has their own writing style.
Right.
Another thing that you hit on earlier on was, intersectionality. So at the community level, communities are impacted by different issues, but within an organization, each department may work on one particular issue. You may have the tobacco people, the diabetes people, the asthma people, and they may all be looking at their issue from their own silo. But being a grants manager, and my role is broader than grants manager, it's really development. I'm responsible for looking at the organization's holistically and not just in one specific department, to make sure that if an issue that we're talking about captures something up that another department is working on that this group may not be privy to make sure to either bring in that other group, or to make sure that we capture the breadth of the organization's work. Right. Because, within organizations, different departments may not talk to each other, just like different organizations externally that work on different issues. You may have the same, stakeholders, you may have the same population you're trying to meet, but, we don't collaborate. We don't, align our strategies, and that's a disservice sometimes. There's so many different competing priorities, whether it's a priority from a funder or it's just an organizational goal. There are the numbers, and we have to talk to each other more. So part of my role really is trying to break down those silos, break down those barriers, to make sure that, we're not applying to the same funder with different projects that kind of intercept with each other, to make sure that the strategy is aligned and it makes sense.
Yeah. Thank you for that. You said something. So I want to give a little story time to your example about making sure that actual grant writing process. So when as you said, the program, the tobacco program that you used to work for, is grant funded. And so during the next cycle, when the grant had to be reapplied for, right, it was really important that we did not just have somebody can you just write this for us? Because it's like you said, if they're not the feet on the ground and they know what things look like in reality, and how, because a grant writer is asking for you sometimes to conceptualize what they're saying they want to do. And it can happen in many ways, right? You can apply for something where you're proposing a project, right? And being like, oh, would you fund this? And that will happen with more private funders. Or you can apply for a grant that has its own stipulations. It is an outline, and that's what they call an RFA or an RFP. There's a request for applications or a request for proposals. And so you will write your application or proposal based on the packet, and sometimes it is a packet of what the funder, and a lot of times it could be like a government funder as the source, and they're saying what they want. And so that's why it's really important, because sometimes it could be something that has been ongoing, right? And it's like the re-application. So it's really crucial to have the people who are actually doing that work. And I'm gonna say like Vanetta, because she's in the chat, to do that, right? So, on the last iteration of the contract, the current tobacco control contract for the program that's in New York City, the entire staff was the grant writer and the grant manager. And so everyone took a portion, right? And so, because everyone had that experience of what actually happens on the ground and how what it looks like in reality, there wasn't necessarily a need to conceptualize, right? Because it's like, we're going to do this, we're going to do that because this works, and da, da, da. And some things can be like ideas, but for the most part you have concrete examples as to why, what you're going, how you are going to make something work. And so the entire team got together. And so I guess, like, in a sense, then I had to be you and be the grant and kind of take it and make it one voice. So one band, one sound. So it doesn't sound like a person, no, because like somebody like who's just off wrote it. So it all is like very consistent. The tone and tenor of the entire contract is consistent. And these are large grants, especially so the more amount of money, the larger and longer your application process will be, and more arduous it will be. So if you're going for something that's like $10 million, which is what this was, it's got to be on point. And so at the end of it, clearly it was on point because we got the contract. So, but to your point, it does help to have a history, right? Because what we did have on our side is like we were the current contractors, and so it's, we know how to do this. So sometimes it's like you have to remind the funder, like, look, we're still here too. We know how to do this, because it doesn't mean that there's not competition, because someone can come in and say, well, we can do it better. We know they've been doing it, but we can do it better. So it's always good to stay on your toes when it comes to the grant writing, because like regardless of how good you are, there can always be somebody better. And so then, to your point that you made earlier, that's why it's always good to like know people in places and have relationships, because it does make it that much easier. But it doesn't mean that you don't have to go through the process. And again, somebody could be better. Like regardless of what your relationship is, someone can be better. But relationships never hurt. And Vanetta says it was a really good learning experience. I'm glad. That's a part of the professional development, right? I'm not gonna keep you too much longer. So, what about so give us a pro, right? I don't want to say con. So say something you wish you could change. So pro about grants management, and something you wish you could change about it.
One pro about grants management is it's a skill that you can take no matter where you go. If you're working in the public health field, I guarantee you at some point in your career, you're going to come across grants, whether it's in the realm of academia, whether it's in direct public health practice or in policy, you're going to at some point deal with grants. Grant writing, you don't need, a fancy course. Being able to write a grant is really being able to summarize the work that you do, and to talk about how, what the outcomes are. So not just the work that you're doing, what is the ultimate impact? Who are you going to impact? What's the population? How will this improve public health? And that is something that you can take with you no matter where you go, because you will always need your work to be funded. Whether you're a professor, professors in academia are constantly trying to get their work funded, the research funded. You hear that all the time. If you want to apply for a fellowship, oftentimes it is similar to a grant application. So it really is a transferable skill. And it isn't difficult to build. And you can take it into your personal life as well. you may have a pet project or a community project that, you really want to do, but you just don't have the funds to do it or the resources to do it. There are mini grants. Start there. I've been doing a lot of pro bono work, especially during the pandemic, where a lot of people are home, they have ideas, my community needs an improved park. I have an idea, but I don't have the funds to make this happen. People who work in development, people who work with grants have the knowledge of the funding landscape. They know who the different players and parties are who will fund this type of work and what opportunities are out there and how to make that happen. So,
It's meant to be great today. How about we do this? Boom, new background.
There we go. Better lighting too.
Yeah. Okay. That's what we're gonna do. Yeah. Yeah, this is gonna be a meme somewhere. We're gonna make it work. Anyway, but go ahead.
Yeah. So, it really is a transferable skill. And whether you work for a nonprofit or if you're starting your own business, there are small business grants as well. So it is a very transferable skill to help advance your career, no matter where you want to go.
Mm-hmm. Yeah. I'm glad this was the entertaining one. Yes, I think that's really good. So I'm glad, that's the pro, because I think you're right. Thank you for saying, because a lot of people do that. What you said, like they'll go take a grant writing course, and it's like, for what? Like, don't
your money
unnecessarily. I think it's just like being a really good writer too, like knowing how to summarize. But like if you're a good writer and you can, something else is happening behind me. If you're a really good writer, you can make it work. So
there are a lot of free resources out there as well. So before you jump to pay for a course, look around the internet. Listen, the World Wide Web has everything you need if you search hard enough.
Yeah. You said something, and I want to make sure, because what I like to do is make sure we put like ways that people can contact you. So we're gonna put Danielle's LinkedIn. Is that okay? We'll put Danielle's LinkedIn in the description box down below. So if you have questions for her that weren't kind of answered throughout the discussion, then just connect with her.
Feel free to message me on LinkedIn, shoot me an email.
Yeah,
I'm happy to be a resource.
Yeah, I'm gonna text you. I'm gonna text you because I've got questions because I'm working on something. I have a little pet project, so we'll link up afterwards. So final question: what advice? Because you already hit on that a little bit, but if you want to elaborate more, what advice would you have, in particular, for an aspiring MPH or for public health students who are interested in grant writing?
I would say go into it with an open mind. If you're an MPH student and you're already interested in grant writing, you're way ahead of the curve than what I was. I've talked about my journey, and I'm still evolving. I'm still learning. I'm still growing. I think I would just say go into school with an open mind. You may go into your program with an idea or with a focus on one area, but you may learn about something else because the field is constantly changing.
It is.
Over the past year, a lot of funding has gone into racial health equity work.
There's a lot.
That is my love, my passion is in community health and racial health equity particularly, but the funding isn't always there. So you have to learn how to keep yourself going and motivated, even when the area that you want to work in doesn't have a lot of roles open, or, figure out how to keep yourself going because the field is always changing.
Mm-hmm.
You can't commit yourself to an area just because it's funder driven. Otherwise, you'll constantly be contorting yourself to shift to meet what a funder's demands are. So commit yourself to a mission, commit yourself to a cause, and keep an open mind, because you may not always have the funding to work on it in a specific way, but you can always get back to it.
Yeah. Yeah. Thank you so much. I'm glad there was something you said. I'm like, as she said, I'm like, yes, I wanted to touch on that. Oh my goodness. It totally went out of my head, but it was, it was, oh no, the question just kind of disappeared out of my head. But you know
Well, I
what?
want to answer one question that asked the double question. So one question I didn't answer is what is one thing I wish I could change about grants management and just, the field of development. It is just that, like what I just answered. It's always changing based on funder demands because it's funder driven.
Mm-hmm.
So, just I really wish that, you could just set out your projects in the way that you want to, but you kind of have to give and take a little bit.
Yeah.
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 But as long as you stay true to your mission and, when it's time to walk away from a funder because they're no longer aligned with your mission, that's okay too. You don't have to constantly chase a funder.
Right. And you know what? I remembered it because it's kind of related to that about like, things changing. Interestingly enough, like when I was in grad school, which was probably around the same time that you were in undergrad, yes, that was the issue. Like the big thing was getting the 40 million Americans who are uninsured, getting them insured. And then after the enactment of the Affordable Care Act, also known as Obamacare, everything shifted. So then everything became about social determinants of health and preventative medicine and things like that. And so public health, really had to shift. And then we're seeing, as you pointed out, a new shift with the advent of COVID. And, I said this in one of my other information with teacher videos, like none of us were around with the last pandemic. That was 100 years ago. You have very few people who are centenarians, 100 plus, who may have experienced and even if they were babies, so they don't remember, who, unless they're like 110, they don't remember, who went through the Spanish flu pandemic. And so this is all new for us, and we're also in an age where we have things like technology and things that they didn't have before, but we still kind of like stumbled through this. The entire world is and still stumbling through it. But I say that to say, like, you have to kind of be on your toes, right? And be ready for the change, because that's the only thing that is constant, no matter what you do. So even in this, public health world is, not as like, exciting. Not all the areas are as exciting. Like some things when you're out in the field, it's more, moving. But like we even see like with COVID, public health became, it was to the forefront. Like people started learning about like what public health is and why it's important.
Right.
So then we became like, superheroes in a little bit. It's like, yeah, this is what we do.
I know. Suddenly people are actually interested in what I do.
Like, well, let me tell you. So, but you do have to be on your toes, because even for, people like us who have, have MPHs, we've seen shifts over the last like 20 years. It's 2021 now. And so there's been so many shifts over these last years. And so you have to really be on your toes and be willing to move with the change. And so that also means like patience, right? And yes, you can definitely like align yourself to a cause, but there's the ways to that cause are always going to evolve because things are shifting. So thank you so much, Danielle, for being part of the show, and thank you for being patient with my like came alive. It came alive. It wanted to be a part of the show. That's all. It just wanted to be a part of the show. So I don't see any questions. Sometimes we have questions, but Vanetta said, she said it was a really good learning experience, because she says this is very informative. I am very appreciative. Yes, so like I said, we do have some people who, Sister Kashia is one of them, who is like looking into things. So willfully, this was very helpful for you. She's a doula. So like it is connected to public health, especially when, you're looking at a lot of sexual and reproductive health programs, and maybe I'll have someone who is kind of from that arena as well. They are looking at integrating more alternative forms of reproductive health care. So, like even the organization that I work for, that they're working with doulas. I'm not sure about when or if they'll be bringing in like midwives, but like it opens up a whole new world for people who think like, oh, I'm just gonna go to the hospital. So public health is very interesting.
Yeah,
So
and it really that gets on intersectionality again, because when
right,
we're talking
right,
about the Black women's maternal health crisis,
right.
doulas are an incredibly important and underutilized strategy in helping mitigate racism in
Mm-hmm.
maternal health.
Yeah, and they're also, it's, I think also it's good to normalize, because the things that are normalized sometimes they shouldn't be normalized, right? Or they're things that don't work for everybody. And so I think the integration and intersectionality of like pulling in doulas and midwives into more mainstream public health, it really helps to normalize like even like giving birth at home, you know and not necessarily having all of the meds and the drugs and and everything. So I think, and so that even moves into more natural ways of like care and things like that. Like, so I think it's awesome. So we'll have more of that on the career spotlight. But right now we have Danielle, who's the grants manager. So thank you so much, Danielle, for spending this time with us and sharing like some of your knowledge and what you know. As always, if you have questions or you have, people that you think would be really great to spotlight for the MPH career spotlight, please send them my way. You can reach me at www.deidresully.com and leave a comment, or you can just send me an email at deidresully@gmail.com. I will also be putting Danielle's LinkedIn information in the I want to say the chat, in the description box on the YouTube channel. So you'll have to come up, for those of you watching on Facebook, you'll have to come over to YouTube. This is where it will be. And you can find her contact information if you have further questions about grants management, grant writing, or the work that she's doing in grant writing for folks like working on the side. So thank you, Danielle, and thank you everyone for joining us. I'm so glad that this was helpful for you. I'm glad it was helpful for you, Sister Ema Sequoia. Thank you, Vanetta, and some new info. Good. So we will see you next time on Information with Deidre, where we will be joined by a medical director who's also an MPH. You are welcome, Nadia Turnage. Thank you so much for joining us. Make sure you share this video far and wide, and we'll, you'll probably see the promo for it. Oh no, but it would be great. It'll be fun. So thanks so much, Danielle, for joining us. Bye, everyone.